for. All right, so Christina, if you like to start the recording, it has happened there, perfect.
Yes, Professor, I just started.
Great, thank you so much. So welcome to all, a very warm welcome to this executive seminar, which is entitled Strategic Management in the Healthcare Sector in the Post-COVID-19 Environment. How is overall business and economic activity affected, by Dr. Emmanuel Alexandrakis. And my name is Eric Söderqvist, and as most of you know, I'm the director of the MBA International Program at Athens University of Economics and Business. Besides welcoming students and colleagues from AUEB, I have the pleasure to welcome also students and maybe staff from some of our partner institutions, Stevens Business School, Hoboken, New Jersey, USA, York St. John University, London, and Athena School of Management, Mumbai, India. The MBA International organizes this kind of executive seminars on timely issues to bring students, alumni, and partners together, and of course to provide insights to trigger thoughts and discussions around topics of high strategic importance in the job roles of our students and our alumni, and things that do not always contain within the courses. One such topic, obviously, is health imperative, because of the pandemic, risen very fast and very sharply on the strategic agendas of business leaders and managers across the globe. And what this means and what are the impacts are at the center of tonight's seminar. So our instructor is adjunct professor Dr. Emmanuel Alexandrakis. He teaches the elective course in the MBA International Strategic Restructuring in the Healthcare and Life Sciences sector. Very timely course and has become a bestseller actually among our electives. He has a long industry and public organization experience in health-related topics, health-related positions, and not only. He has served or serves as policy and CSR manager in MSD, Merck Sharp Dome, as senior advisor at the Hellenic Parliament on the Economic Adjustment Program of Greece, manager and researcher at WifOR, which is an economics analysis think tank headquartered in Germany. So a very welcome, warm welcome to all of you again. And Dr. Alexandrakis, the space is yours.
Thank you very much. Thank you, Professor Söderqvist. Thank you very much all for your participation. We are a small group, so even if more join us, I think we're going to have a lot of nice time for interaction, and I hope that I can trigger your reactions in some of these things. So number one, please feel free to stop me at any point. We can I can easily follow up afterwards. And secondly, just give me a second so I could upload my presentation, my PowerPoint presentation, so we can have it as a reference. Okay, so it is being uploaded. Can you hear me well? Can everyone give me a thumbs up or something if you can hear me? Excellent, thank you. Thank you very much, Eric. So, can you see my presentation? Great, thank you very much. So, today, the title of our discussion, my presentation, is Strategic Management in the Health Sector in the Post-COVID-19 Environment. So, a lot of discussion is happening on what is going on. We have a lot of information, but I can assure you there is still much more to come. So we're going to discuss on how the overall business and economic activity is affected. And we're not going to discuss only about the health sector, but we are going to have a discussion on the overall environment that is anyway affected by the health dimension, the health aspect. So let me start by initially talking about some introductory comments and remarks and presenting some facts that will kind of get us into the mood of what we are seeing in this post-COVID area. Then I will talk to you about the paradigm shift in health and some new perspectives on health investments. Why is the health economy important? Some facts and figures will be presented, and conclude at the end with some remarks and give you some information on what we do at WifOR actually. So that would be really interesting for some of you. So please try to connect whatever we discuss in this session with your industry. And do challenge me, please, if you do see that there is something that you can relate with your industry. You will be surprised how close these things are. Now, I see some of my students are online, so some of these things you have heard about, but we are going to move, I think, a level beyond that in this seminar, so we can try to trigger our thoughts on what is going on, what is happening. And, you know, everyone is talking about how to adapt in times of turmoil, in times of change. So the more you understand the environment, may that be internal or external environment, the more and better you can adapt in your business activity. So I would like to give a very practical dimension into this discussion. So let us start by some facts and some introductory comments that I have. So first of all, you know, we're talking about strategic management. Now, strategic management is all about strategy. It's all about management. And when we are talking about strategy, we're talking about the management of ongoing planning, of monitoring, of analyzing, and of assessing everything that the organization is required to have in order to meet its goals and objectives. So this holds true for any organization, may that be a private or a public organization. Now, when we talk about management, we're talking about managing changes in a business environment, and a business environment is not operating in silo. We got to know this during the pandemic era. All business turned upside down, and many changes happened so dramatically that businesses did not have adequate time to adapt to those changes. And even if they did, they could not adapt because of the external health problem that created a series of events in the economy, in society, and in the health systems. So we had a multi-level crisis and disruption that was not easy to be managed. Now, supposedly, and what we discuss worldwide at different fora, this was a lesson for us to find ways of arming our economies, our societies with tools and with things that could protect us and make them more resilient and more protected to such unexpected crises and pandemics. So managing requires organizations to constantly assess their strategies and adapt accordingly. Now, the post-pandemic has changed so many things in the economic environment. And just to try to summarize some of these things under three main, let's say, titles. The first would be the macro and fiscal environment. So when we're talking about the macro and fiscal environment, after the pandemic, most countries increased their debts, increased their deficits in that period because they had to spend more money than what they were collecting On the other hand, businesses, a lot of businesses stopped operating, so taxes were reduced and public spending went up. Private businesses, entertainment business actually just ceased, stopped functioning. So they had to, some delivery shops had to quickly, let's say, adapt to the new situation. A lot of the selling went on, but again, there was a huge disruption in the macro environments where we saw deficits of countries and therefore debts increasing dramatically. And the fiscal environment, and when we say fiscal, again, we're talking about government spending versus taxation. Well, fiscal environment was really squeezed, where we had less taxes, as we said, and a lot of government spending. So this was a huge shock in especially economies that were anyway heavily indebted. Greek economy, Portugal, Spain, Italy, were economies that are going to be facing a lot of problems within the next few years. Going on the second topic of inflation and monetary policy changes, well, you see, inflation is something that was started increasing in the highest levels that we have seen over decades in Europe and the United States. So this means that there's corrosion, there is a depletion in the money assets that people have. So you buy less things with the money that you keep in your pocket, and the more you keep this, the more the values are corroded. So monetary policy actually had to change. First of all, monetary policy changed in the first part of the pandemic. So you see, for instance, the ECB, the European Central Bank, that affects all the banking system of Europe, eased measures that had to do with collaterals. So we had collateral easing measures. So banks could actually raise cheaper capital and boost their lending so they can help the economy while we had shortage of cash. And this happened early on the pandemic at the ECB, but also in the United States with the Federal Reserve. At that stage, we were all afraid of inflationary trends, but we are more recently seeing them skyrocketing. So there was a time lag until inflation came in. Now we are at a period where, and this is happening now actually, where the ECB announced last April that as of July 2022, they will phase out over a 3-year period many of the changes it introduced in April 2022. So actually, they are stopping the relaxation or decelerating the relaxation of the banking rules that they had, and also are also considering to increase interest rates. Now, on the other side of the Atlantic, we say the United States, well, they already started reducing their assets and their holdings in their balance sheets. So they're talking about selling, instead of buying, selling an amount of approximately 95 billion bonds. So this means they are collecting dollars back into out of circulation and back into the banking system. And also, they already announced, I think, early this month, 0.5% increase in the basic interest rate. So this is a 50 basis point increase. And this is an effort to actually mitigate the the inflationary spurs. And in the United States, as I'm sure many of you have heard, they're talking about tapering. So once the goal of, let's say, stimulus that the Federal Reserve wants to bring into the economy, let's say, is done, then they start unwinding the purchasing of bonds. So it is like we are actually taking the foot off the accelerator. So it's not that they're not buying, but they are buying in a progressively lower rate. To make a long story short, they are pulling money out of the markets and increasing interest rates. So this is a very major impact that the pandemic crisis had. And this is something that we will have to live with, in my opinion, for the next several years. And this is affecting our daily lives, our consumer spending, but also our business activity to a very large degree. Lastly, my third point has to do with the production function itself. Production function in all businesses literally has changed after the pandemic. What does this mean? Production is a function of its labor, of the assets, capital that they use, and of the supply chains. So we saw huge increases in the cost of transportation. So supply chains have dramatically been influenced by the transportation rises throughout the past 2 years. We also saw a very different labor market. So we see people changing skills. We see people working in different environments. And we also saw a lot of shutdowns, to mitigate the health impacts. And these shutdowns have created bottlenecks. I mean, the most common example would be the shutdown of the Apple manufacturing plants in China. So you saw they created a huge disruption. There's a huge disruption in the semiconductor industry. I have a friend that recently ordered a BMW from Germany. It's a special edition anyway, so he's a big fan of nice sporty cars. And he had BMW decided to change the design of the dashboard at some point because they were lacking semiconductors. So they did some modifications to use less. So I was very surprised, but this is something that you could feel the repercussions it could have later on in many, many things. So what are some of the key points that we will discuss tonight? First of all, how did the recent pandemic crisis change the way that we understand the health-related spending? And I'm not only referring to healthcare spending. I'm referring to anything that contributes to a wellness, to a healthy population. And all this, I would define it as health-related spending. Also, we will talk about why the health economy is important and why it's in itself a very important sector that affects all of our activity, all of our lives, and for sure, all the economy. And finally, I hope that I can provide you some insights for understanding the health imperative in business and society. So this lecture is not about health. It's about the importance of health in other sectors. So some of the issues that will be addressed in this seminar are actually related to the paradigm shift. So we will try to understand what is the health economy and why is it important to measure it, to monitor it, benchmark it, and measure it. We will talk about why we should view health-related expenditure as an investment and not as a cost. So this is a huge change in mindsets. It's a huge change in policy, and it's a huge change in opportunities that arise in the private sector, in business and banking. So it's something that really would affect the finance sector, the real estate sector, all assets, whatever they are. So this is a huge change again. And finally, we are going to touch upon why it's so important to assess returns of investments of any health investment, any intervention that touches the health factor in order to make smart, evidence-based, fact-based decisions. So I just tried to put this, by the way, I could make this presentation available to all. So I think we have all of your emails. So I could ask our secretariat to share my slides for your information, since we have your email, since you asked for the link of this session. So I will share afterwards on Monday, I think, this presentation. So let's just have a quick look on mapping some of the impacts so we can get a better feeling of what these impacts are all about. First of all, do we have any questions up to this point? Any comments? I don't see your faces. I see just letters, so you're all listening, but I don't have any reaction. That's the negative part of having a TC. So are there any comments, questions up to this point that you would like to raise? Okay, no comments. So economic impact. Well, these are the obvious ones, okay? So some sectors, like the health-related ones, increase revenues, increase profitabilities. You saw what happened with the vaccines. People were making a lot of money. Although other sectors were really flanking, they couldn't operate. So I'm talking about the leisure industry, the airlines, cultural activities, and so on. They had devastating effects. Now, we have observed that throughout geographies, so there's a huge differentiation on the impacts. So there's a huge difference when you compare countries to each other, when you compare regions within the same country, but also when you compare sectors. So transportation sector is making huge profits and did make huge profits within the top period of the pandemic crisis within these past 2 years. So there were severe disruptions, and there was also disruption of the balance, and there was a huge increase in inequalities. So the people that were in the most unfavorable positions in the economies, the poorer people or the people that were disadvantaged, came into a much worse situation. So this is something that should be a matter of concern to all of us, because capitalism should always consider what happens with inequalities. That's one of the basic points that we should also keep in mind. Huge impact, as I said, on culture and entertainment. It's obvious, theaters, musicians, because they just shut down, no one was working. There was an impact on information. So there was a lot of misinformation. There was a lot of media manipulation. And that gave rise to a new set of problems that were not as evident before. There was a huge also impact on society and rights, like human rights, gender rights, children. There were a lot of legal issues that were very unclear that came up. There were many mental health issues that are not as easily detected, so it's even worse if you don't know what's going on. There was a lot of social activity disruption, and impacts on health workers were huge. I mean, they were not enough, and the system was out of function in many cases. And of course, elderly. elderly has a disadvantage, let's say, as a vulnerable, maybe not use the word disadvantage, but vulnerable, I think it's much better, part of society had serious problems. Work environment, well, here we witnessed the merge of work and personal space. So we also had some positive impacts, and let me just mention the impact on the environment. When you have factories shutting down, you don't pollute, as simple as that. Now, the question comes that after the economy is open and factories start working, they will most likely operate in an accelerated way. So this means it can pollute even more. So I'm not sure that was a huge advantage. But one advantage that I did see is that because airlines were just landed, and airlines are the single most important pollutant in terms of CO2 and so on, there was a very positive impact on the environment on that side. And one last thing that I put in this little circle here on the right is that, the COVID-19 pandemic also disrupted other infections and other infectious diseases. And these are popping up in very unusual ways that we are now witnessing. So, you see unseasonable surges in flu, you see the emergence of various diseases, like the recent one is monkeypox, that we saw that came out. You saw this kids in hepatitis C. It's very strange. We don't know what the relations are. So it's something on the move. It's something that is happening now. Now, why am I mentioning this other than the clear health, let's say, issue as a very important part? I'm mentioning it because these viruses are actually having an impact on the cost of healthcare and on the cost of all the value chain. So if you have to pay for these things more money, you will have less money for other parts. So it's moving resources actually from one part to the other, and this is an important thing that should be studied further. And these viruses, as I say in the little box on the lower right, are not different than they were before, but we are. So we have changed. Our immune system has changed, actually. So Helen Brunswell contributed this, and there's a big discussion on how health protections have slowed the spread of COVID-19, but have shifted the normal patterns of infections. Now, if you do think that normal pattern of infections, other than COVID, will not affect our business activity, our life, our financial capacities, you're wrong. So this is a very, very serious effect that we have noticed. This is just an image that will give you some numbers. These numbers are up to 2021. So we had 1.6 billion children out of school. We had 1/3, virtually 30% drop in investments in clean energy transition. And we had an increase of a huge number of poverty, of people that entered into poverty. So we expect that by 2030, so that is in another 8 years, we're going to have another 250 million people just by virtue of this pandemic becoming poor. Some figures you can see here. This is the real GDP from 2016 to 23. So you see in 2019, we had like steady low growth in most countries, the world, OECD, Euro area, and so on. And in 19, dramatic drop. And you see countries like Greece, for instance, this is the blue, had like a -9.5, -10% real GDP drop. And then as of 2020 onwards, increases have started again. Greece again is a little bit better because it had such a dramatic fall that it has to grow a little bit more. And again, you see that things after 21 started, 2020 was from nothing we went to a lot. And then we started again, stabilizing. So real GDP is growing, but was, well, in most countries, the total annual growth rate was dropping actually, okay? But not as bad as it was before. So this is a graph that shows the trend of debt. We talked about debt. So debt as a percentage of GDP over the period 2012 to 2021, you can see that things were kind of similar. Well, they were moving in the same, let's say, direction. If you compare the European Union and the United States up to 2019, after 2019, you see that the European Union started dropping their debts. The United States had a steady bad debt. And then 2019, when the crisis got in our lives, then you did see debts being skyrocketing. We talked about this already. So after 2020, when we see a climax in the European Union, then debts progressively have started decreasing. In my opinion, in some countries, as I said, like Greece, Portugal, this blue line will start increasing again, and it's really bad. It's bad for the future, it's bad for development, it's bad for sustainability of economic development. The United States is still facing a serious issue in that sense because it's still increasing. Now, one of the big things that we did notice in many of the economies, many of the countries, is that public spending as a ratio of GDP increased. So you see, of course, Greece has the record high. They in 2020 they reached almost 61% of the GDP. We had a decreasing GDP, increasing public spending. That is over 60%. That's huge. This is huge. The EU average was around 45% in the pandemic. And you see the US average, from 2019, it was much less, it was 34%, but in 2020, it also increased and it went to 44%. That's very close to the European Union public spending ratio. Well, that's another area that is bringing a lot of problems. Okay. Any comments, any questions? I see a lot of silence. I hope you're following me. I don't see any pictures, but I do see a lot of people now. So, so I don't know how you are following me. Can you hear me? I don't have any oh, great. I got one thumb up. Thank you. Excellent. Thank you very much. Please do stop me and comment, okay? I'm really looking forward for this. So this graph here is some comparisons of the general government debt in Europe as a percentage of GDP. Again, this is you see the blue is for 2021 and what is this pink reddish color is for 2020. So you did see that again, Greece is a champion in debt. But you see other countries, Italy has a serious problem, Portugal, Spain, France, Belgium, and so on. And you see, Luxembourg and Bulgaria and some other countries here are very low, I cannot read them. So again, government debt is a very serious problem that affects economies and our lives, and our activity. Now, some facts and figures. Let me give you just some hints on expenditure and returns, because we did talk about returns of investment of our interventions. And my position is that we have to measure things. We have to have evidence-based policymaking. We have to make decisions, educated decisions, smart decisions. Oops, give me just a second. So I can do something here. And so So global healthcare spending is often over or about 8 trillion on an annual basis, and it increases always faster than GDP. So that's a fact that we should keep in our minds. We're talking about a big chunk of private and public money. Private money may be from out-of-the-pocket expenses of people or insurance, private insurance money. That's private funds as well. And public money is anything that is through the public sector. So may that be with public social security organizations or direct subsidizations of states and so on. So we see that, we're talking about different speeds of increasing. So 8 trillion euros is actually pumped into the economies on an annual basis, and it's connected with healthcare. So that's a big amount that we should be careful to understand what it does in the rest of the sectors. The estimated mitigation costs of the pandemic, of COVID-19 pandemic, for the G20 countries alone were around 12 trillion. And this was a figure that we had up to 2021. I don't know about 22 yet. So the pandemic's financial and societal implications were far greater, if I may say, than the 2008 financial crisis, even if you see the numbers up to 2021. Now, the 2008 financial crisis was a serious crisis that still, in many countries, have left a negative footprint. So you can imagine, this means that things are a little bit worse on the side of the pandemic. On another point, the IMF and IMF data demonstrates that medical solutions that reach societies faster and at scale would result in an increase in global income of almost 9 trillion by the end of 2025. 2025 is in 3 years, so we're not talking about a very long-term impact. So medical health innovations that can reach societies fast and at scale, so many people, let's say, would benefit from them, could result in plus $9 trillion in 3 years' time. Now, why am I mentioning this in relation to the pandemic? Because the pandemic in many regions of the world showed us that innovation could become much more accessible to people. So we did see drug approval, vaccination approvals were happening in a much faster way, following rules again, on the one hand. On the other hand, we saw a lot of innovation on data basis, artificial intelligence systems in exchange of data, IT innovations overall. So this actually shows that this could be a booster, could be a huge enhancer of increasing GDP around the world. And finally, just the figure that I would like you to think about is that just for the lower and middle income countries around the world, we need an additional investment of $371 billion per year. And this is a figure that was calculated for the years up to 2030, just to reach the health system targets that are established in the context of the SDG 3 UN Sustainability Development Goals. This has to do with health itself. So we are now, the WHO was talking about a financing gap of 20 to 54 billion per year. So this practically means that we are missing 20 to 54 billion, depending on what country we're talking about, just to be able to sustain the targets that we have all agreed on the population health around the SDG 3. Now, those investments could save 97 million people from dying and also increase life expectancy drastically. Now, life expectancy means two things. People that live more can produce more, but people that live more and are elderly could also spend more in terms of the needs that they have. Are you guys with me? Are you following my reasoning? Can I get a thumbs up or something since I don't see you? Great, thank you very much. So this is a graph that I've presented it several times in class, but I love it. This shows how important health expenditures are to set up a future defense plan, just to stabilize the economy. So on the blue line is the global GDP growth in percentages, and the red line is the global current health expenditure as a percent of GDP. Okay, so these are global figures, and we have figures from 2006, and I recently updated this for 21. So we have a projection. The dotted lines are the projections for 20. In this case, it's 19 to 20, and the blue line is 21 to 22. So what we see here is that whenever global health expenditure pops in, increases, it increases when the global GDP growth is dropping, and you see that there is a in tandem dance between these two figures. And in fact, when you spend more in health, you see you start increasing GDP rates and so on. Here we have relative stability, but look what happened in 2019. 2019 was a dramatic drop, as expected, in global GDP growth rates. Here it is, from 2009 to minus 3.1. And we started pumping health money into the economy. And what happened when we started, when we started pumping, would you please put your microphone on mute? I don't know where it's coming from. Okay. So, so we saw that after 2021, 20 to 21, things started increasing in terms of GDP because we were spending on health and people were getting healthy and back to work in big numbers. And this is stabilizing again, just to get an idea of these figures. So there is a connection between health expenditure and macroeconomic effects, macroeconomic impacts. When health-related expenditure is reduced, health authorities typically only consider their own budget, and they omit any possible macroeconomic impacts of their activities. We do know, and we do have evidence, however, that health expenditure has an impact on the macroeconomy. So I've written an article with Professor Oswald and Mr. Leidner in 2021 that we have entitled Towards a Health Economy Policy, a Consolidated Economic and Health Policy Approach. So we are talking about having joint health policy and economic policy targets and goals, because these things, again, go hand in hand. So when you put one goal on the side, you'll have to consider what's going on the other goal, and vice versa. Up to this point, this is not the case. In most countries, what we did notice is that health ministers are trying to transfer budget from other sources without making a case of, seeing this expenditure as growth expenditure, as investments in the societies that can bring more wealth and at the end bring prosperity. So that's a shift. The good news is that we do see in many parts of the world, and we are discussing within the fora of the G20 and G7 and the OECD, even the European Union start to consider this. We are discussing in joint finance and health ministers discussions on how to finance the necessary funding on health that is needed to boost the economies, economic growth and economic development. So there is a definite connection. Now, there's an urgent need for measuring health impacts. And it's even more important in the post-pandemic world. Why? Because as we saw in the previous part of my talk, things have changed. So we need to be very careful on where we spend our money. So investments in the health economy are demonstrated to be very critical for societies, but also for economies. So you don't have sustainable societies if you don't have health spending. So if you live in an area that you can have a lockdown, you shut down factories and so on, you're going to have a societal problem with a lot of unemployed people. Likewise for the economy. A second point is, as we do for any investment in the world, so this is a financial discussion that we're having now, we should also do the same exact thing for any health intervention. That is, to measure its impact and returns along the entire value chain within an economy. This approach, dramatically unsustained, is changing policymaking. So we see a convergence of economic and health policy objectives, as I discussed in the previous slide and in the paper that I authored last year. My third point is that there's a new landscape in the labor markets, and we have new hybrid work forms, and this has a lot of disruptive consequences that reset values of assets, and this happens throughout economic sectors. So I was asked to write a commentary on a real estate trade magazine, and repercussions in values are really changing because of the changing labor markets landscape. Okay, we do have personal and professional, let's say, activity, very confusing nowadays. So since a lot of people are working from home, you can see that this is becoming kind of blur. So you see there was a need for several countries to change laws. Greece is one of those, so they can try to cater and address the needs of this changing labor market. So this labor market is a very significant part of the production function. So this has a catholic impact. Now, are you with me? Any questions, any comments? You guys with me? Yes. Okay, so I see a hand. I'm very glad. Mr. Papastefano. Yes.
Hello, Professor.
Hello, hello.
I would like to ask you regarding the remote work.
Yes.
Usually, out of my experiences, there were some people before COVID that they had a burnout effect because of work. And I'm thinking just right now, if because of hybrid work, this phenomenon has decreased or not, or if we have any evidence, any clues about it. Thank you.
What was the effect that you commented? I did not hear you.
The burnout effect.
Oh, burnout. Okay.
Yeah, because now people might spend more time home, so they might feel less anxiety if this effect has decreased.
Yes, a good comment, and thank you very much for raising this issue. We did have a lot of evidence in mental health disruptions, but in my opinion, a big part of them originated from the burnout effect that you talked about. So, when you're home, it's very easy just to go on your computer screen and do your work, or, it's very easy to participate in more teleconferences than the real conferences that you would do. So, you know, in our job, we found ourselves having so many meetings every day because it was much easier for people that were locked into their homes to have a meeting, regardless of if someone lived in Colombia and the other person was in Japan. So, you know, we found times that we could all cater to this need, and we had more meetings, more decisions were made, and more activity was going on in many, many fields. So yes, there are several studies that connect burnout with either depression syndromes or mental health. And mental health, Mr. Haralabos and the rest, is becoming a very, very serious issue, very serious problem. Okay? So I think that we'll see much more coming. And especially, you know, we're talking about, again, the either very young people that, you know, they were not very well adapted to such situations. So for instance, my 5.5-year-old little son spent these past 2.5 years, a lot of his time, in fact, was through TCs. And he was in the pre-nursery, he was in the nursery and pre-kindergarten, now kindergarten, hopefully kindergarten, he is there in vivo. But the previous years, he had people that he had never met, his teachers and so on. So this is a new way that these little kids entered. And we see this has happened throughout the world. On the other hand, we had a lot of, let me say, these were not work burnouts for the elderly, but these were socializing burnouts. So you saw a lot of elderly people had serious problems, serious depression, because they couldn't see their grandchildren, they couldn't see their families. They were not very apt to technology, although a lot of them became very familiar with using, you know, mobile devices and so on. But yes, this is a problem, and I think we will be living with this problem. So we will never go back to the way that we operated before the pandemic, in my opinion. So we will have to very carefully monitor burnout issues, and it's not as easy. It's not a problem that is solved. And also, we should also to make provisions for hybrid type of work to kind of relax the pressure of these burnouts. Okay.
Thank you very much, Professor.
I'm sorry?
Thank you very much for your answer.
My pleasure. Thank you very much for the question. Any other common question? Okay, so let's talk about what we name the paradigm shift in health, and give these new perspectives on health investments, how we can view health investments nowadays. So this is a slide that I've many times talked about, and I think some people that were in my class have seen this before. But you know, in the past, health expenditures were discussed politically only as cost factors and not as investments for sustainable development and growth. So on the one hand, we have governments aiming to keep the costs down. So 80% of current health spending is from pooled sources, and public budgets on health are overstretched throughout all countries. Then we already talked about the increasing health expenditures that are necessary to sustain or achieve the SDG goals. SDG 3, example, was the 371 billion that are required in the lower and middle income countries, according to the WHO, per year as an investment. We already mentioned this. And health expenditures are expected to skyrocket. So we're talking about within the next 8 years, they will for sure exceed 11 trillion, if not 12 trillion. I think it's even worse than what those projections are. So convincing the right stakeholders to invest in health and cost-effective solutions is very decisive for our social stability and for our sustainable growth. Now, reframing healthcare expenditure as an economic investment is actually telling us that we have to switch to a value chain of health viewpoint. So investments in health would definitely strengthen growth, stability, and enhance resilience. So the investments in health lead to higher added value and employment. Secondly, they strengthen all the value chain, all the supply chain, and investments should be made along the entire health value chain. Thirdly, they generate positive spillover effects, so effects outside of the immediate health activity to other sectors. So these spillover effects lead to increased added values, to increased employment, to increased trade. We have noticed that where we have a lot of health activity, and I'll show you some numbers at the last section, you do have increased trade. You have more exports. We measure this in Germany. And you see more innovation, more wealth in the economy as a whole, and so on. And finally, these investments just improve wellness, improve our health conditions. So there are definitely positive direct effects as well as the spillover effects that contribute to better population health and consequently to more wealth. And if wealth, as I say many times, is equitably distributed, then we can reach prosperity in society. So the final point is that investments in health are investments with a high ROI, a high return on investment. So a positive impact on healthcare, the economy, employment, and overall on the wealth and prosperity of society is what we're talking about. Now, WifOR that I work with is fostering this paradigm shift in healthcare. So from a cost factor to a driver of growth, innovation, wealth, and prosperity, but prosperity with better health conditions. So healthcare is not viewed as a cost factor. In the past, we had these silos and fragmentation, and we're talking about healthcare only. It was input oriented, and we were talking about increasing health expenditures that were viewed only as increased costs. Today, in the future, we're looking into the health economy as a driver for growth and employment. So as a growth sector increases employment, gives new career opportunities, better work conditions, better quality and more outcome oriented, not input oriented. And it's an investment in health rather, promotes growth, productivity, sustainability, and resilience of the economy and of societies. So what we do in this research around the health economy is aligned with what WHO claims. So the health sector, according to the WHO, is exactly what we are working on, is enhancing economic performance and stability of the country. It also has a positive impact on economic performance of other sectors, not only the health sector. So it really has a positive impact on the national economy, creates jobs, generates, and also additional jobs, indirect, let's say, effects, impacts that are generated from the purchases of goods and services of the people that are working and being paid for these initial works. It has a very major, significant role in reducing social exclusion. This is one of the things that is not discussed as much as it should be, because, for instance, at a local level, at the community level, it has a huge impact on employment, working conditions, and household income. So this means if you provide health investments and you have a healthier community level, at a community level, a healthier population, then you will, by definition, be reducing social exclusions. So it's the easiest and smartest way to reduce social exclusions. And you can increase status as a key sector for driving forward the implementation of local and national goals for sustainable development by just enhancing employment, training, and purchasing functions, both at the local and the national level. So these are the positions that we are all aligned with. These are the official for health sector, let's say, features, if I may. Now, this is another graph that some of my students at least have seen before. This is the health economy. So the health economy is a heterogeneous sector that comprises a wide range of goods and services that are assigned to three subsectors. So the first and most common is the so-called healthcare economy. These are the doctors, the hospitals, the outpatient services, dentists, and so on. So all this activity is part of this what is it, third of the cycle. On the right-hand side, we have the industrial health economy. Well, this is as the word says it itself, it's the pharmaceutical industry, the medtech, wholesalers, hygiene products, sports and wellness, fitness equipment, e-health, and so on. So this is the industrial part. This is most advanced economies. This is the biggest and strongest part. And R&D and so on is part of this. And the third subsector of the health economy, as a distinct sector, as we said, is the so-called service and support sectors. So here we have insurance, health insurance. Here we have health tourism. We have all services that cater to producing the health results. We have the retail services and many, many innovative new services that are working, all these IT-related work and so on around the health sector. So this is a sector that is growing much more during this time. At WifOR, when we work with the health economy, our starting point is the most important, in my opinion, KPI, the so-called GVA, the gross value added. So the gross value added measures the contribution of a specific activity of a specific sector according to the national account systems to the GDP, to the gross domestic product of a country. So actually, if you take turnover and you get rid of the input factor, you get the GVA. And to see it another way, the GVA is the slice, if I may say, of the GDP that is attributed to the activity of the specific sector. The sum of all GVAs in an economy comes up equals to the GDP of a country. And having GVA contribution figures, that is in money terms, in dollars and euros and so on, between regional national policy objectives, sectors and enterprises allows us to have comparability. Otherwise, we are not comparing similar things. We're comparing oranges with oranges, apples with apples when we are talking about GVAs. So it's a very, very important KPI that you can make a lot of other indices around this and with this ratio, with this KPI. Now, this is a graphic that shows how the health economy generates, not only, as we said, direct effects, this is the red part, and these are the immediate effects directly generated by the health economy, but also the spillover effects. And these are two parts. The dark blue are the indirect effects. So it's actually the intermediate consumption is what arises due to the purchasing activity of the red guys, the direct contributors. And then we also have the light blue part that are the induced effects. So this means it's whatever is caused by expenditure of the red and the dark blue. So red and dark blue expenditure give rise to additionally generated incomes that are induced impacts, induced effects. If you add all three of these, household and suppliers, with our WifOR methodology, we get the economic footprint. We get what the footprint of a health economy, this distinct and powerful and pivotal, in my opinion, sector to do. Now, just share a couple of slides with the SDGs. Now, SDGs are becoming more and more important. There's not one single big company that will not be concerned with the SDGs and their sustainability reporting. So what we are doing actually at WifOR, we are embedding social impact, as we understand it, into SDGs. So when we are measuring better health, when we measure, let's say, innovative medicine and their impact in the macroeconomy, GDA and GDP, yes, better health is created, but better health is also creating more innovation because these are innovative medicine, and the innovation system is enhanced as well. So more innovative products other than medicine that they could be produced. I can go on and explaining these things. We are contributing to SDG Goal 9, that's talking about resilient infrastructure, promote sustainable industrialization, and foster innovation. So this is the innovation of the environment, but also SDG Goal 8 that talks about inclusive and sustainable economic growth, full and productive employment, and decent, good work for all people. So all these three are being boosted by the health economy, actually, by health investments. And if I may dare say, in our approach at WifOR, we believe that SDG 3, good health and well-being for all people, to ensure healthy lives and promote well-being for all, is at the center, at the heart of all goals, actually. So this is what we should measure, and we should see how this impacts on all the other SDGs. So we do this, and we're trying to more systematically find common denominators among industries, sectors, to measure these things. So we are part, at WifOR, we're part of the Value Balancing Alliance, if you've heard of it, that we're trying to find common ways to measure value, society, and a company. So there are a lot of things that are going on. As some of you already know, I've been involved pretty heavily in the G20 work. And a year and a half ago, we wrote a paper at the during the Italian G20 presidency, for the G20 presidency and the Business 20, the B20 Health Task Force. And this paper was entitled, we co-authored it with a whole bunch of people. Alan Donnelly was an ex-minister of the UK and member of parliament. Professor Rifat Batoun is a professor at Harvard University. Dennis Oswald, the founder, and a good colleague, and Sandra Hoffman from WifOR, and Hatice Kuchuk with Andrea Lucar. We co-authored a paper called "If We Can't Measure It, We Can't Fix It." So our whole aim with this paper was to convince people that we have to create common metrics to assess health investments, measure their impacts on economic growth and societal well-being, and ensure health and financial system resilience. And what we were saying is that health economy reporting, so this is actually the analysis of the health economy, measuring the health economy, is an evidence-based tool that could smartly guide, if I may say, investments for health, for employment, and for sustainable growth. So we are fostering the paradigm shift to viewing health expenditure as investments and as drivers for societal wellness growth, instead of just mere expenditure and cost factor. Okay, so again, we can provide comparability of the health economy with other sectors, and how this sector influences and affects the other sectors. Initially, we suggested in this paper that we should have a 4-step value framework approach in order to assess impacts of health investments and to see how these interplay with other sectors. Our approach was very warmly welcomed by all the G20 people and the B20 people, and we channeled in this analysis and this framework, this approach into the G7 UK presidency, that again was very welcomed. And the discussions are undergoing now with the Indonesian G20 presidency and so on. Now, initially, we talked about a 4-step value framework because we didn't talk about the environmental impact. But then we sat down and thought about it, and the environmental impact of health investments is another factor that we should consider into this idea. So what's the idea? We start from the macro level and we reach a micro level. So the macro level is to look at the health economy and measure it. So investments in healthcare and how they lead to added value and employment overall in a country or in a region. Then a second level is to calculate multipliers that actually measure how one sector within the health economy is affecting the other. So if you have a lot of R&D, are you going to have more pharmaceutical launch of drugs or not? Things like that. But these can be measured in terms of their impact, one sector to the other. And then at the third level, we measure how the health economy itself activity gives spillover impacts beyond the health economy activities to other activities and how it influences value added, employment, innovation, and wealth in the overall economy, the wider economy. Then we added the environmental impact on health investments that we monetize. Let me repeat myself. We give number values. We give euro-dollar values. So we can see if there's a positive and a negative, we get the difference. So big multinational companies already report this offsetting system, let's say, in terms of value as measured in money, in dollars and euros in their annual reports. So several companies have followed this now. We work with SAP, with Novartis, and with many other countries, with Porsche, that are adopting these approaches. And finally, we have a microeconomic approach that we suggested, and we are working on this several years now at WifOR Institute, where we have the so-called social impact of health investments. So any health intervention that has clinical information, so may that be an innovative drug or whatever health intervention or health method, we could measure in euros, dollars, the positive direct and spillover effects and how they contribute to better healthcare and consequently to better productivity of the society and more wealth. A healthier population could become a wealthier population, and we measure these things. So we can see what, let's say, an innovative drug that is launched in a country could offer. And so this is a way that you can analyze along those spectrum. So just some indications. I'll just run through this because we just have another 10 minutes and I would love to. Is there any question up to this point? Because I'd rather, respond to your thoughts and concerns than just keep on presenting some numbers to you. Is there any question? Is everything clear with everyone now? Okay, so some examples. Oops, hold on. I see two hands. One from Ms. Carenziotti, or that was a thumbs up, I think. Yes, was that a thumbs up? And from Mr. Haralambous? Okay, so question or thumbs up?
Thumbs up.
Okay, good. So talking about returns on investment, sustainable health investments for healthy societies and economies. And if you see some numbers that were calculated by the team of Professor Atun, Harvard, the return of investment in cancer for children was estimated to be $3 for every $1 invested. That's a big high return, as you can see. The return of investment of imaging diagnostics, MRIs and so on, and care for adult cancer patients, for every dollar invested, gave a return of $12.43. That's huge. I mean, this is really impressive. The ROI, reduction of mortality rate, if you see technology investments to the low middle income countries that could achieve mortality rates like those in the best performing middle income countries, would exceed costs by a factor anywhere from 9 to 20. So we're talking about huge ROIs for societies and for the patient population themselves. And this is a very impressive number that I would like to share with you. We did a study with WifOR in Germany, and the burden of migraine disease, that's something that everyone thinks it's not a big deal. See a rising hand. Let me just finish this and I'll give you the floor. The burden of migraine disease, migraine headache caused an economic burden in Germany of over 100 billion euros for 1 year for the 2017, according to our calculations. Now, have in mind that Greece's GDP is 165, 170 billion, so that's a big number. And there was a productive reduction equivalent to 1.2 billion productive hours due to the migraines. And this is something that is very connected with the woman population as well. They're more prevalent in women, this disease. Mr. Giorgi, you have your hand raised. Please go ahead.
Yeah, just a question, Professor, if you could elaborate more on the return of investment part. This return of investment is, for example, due to, savings on actually treatment. For example, if you go in cancer, these $2 additional that come back compared to the one invested,
yes,
come from the reduction, for example, of treatments.
Yes.
So it's actually society return on investment.
Yes, thank you very much. That's a good question. Not only from that, it's due to the reduction of treatments, but it is also due to the faster capacity of this patient to re-enter into the productive area. So when someone is ill and is going under, let's say, a treatment, she will not be working or will not working effectively. So this is measured in less contribution to whatever they do, even if we are talking about the informal economy. So, when we measure these figures, we many times include the informal sector. So, for instance, retired people that are typically contributing to the households of their families, grandparents that could keep the kids or whatever, this is adding value to society and to the economy, but it's not paid. It doesn't mean that because something is not paid, we cannot measure values. So it's not only because of less costs that you will have to incur if you don't do this, but it's because of more productivity and because what we were talking a few minutes ago, because of the impacts of this specific thing in many levels of the value chain, in the indirect sector. So these people have more money, they will go to restaurants, they will be members of sports clubs if they're healthy and so on. So it creates more activity. And both of those expenditure would also give rise to a third part called induced. Okay, so it's clear?
Yeah, perfectly, thanks.
Thank you. So I see we just have 5 minutes. So I guess that a lot of these numbers, let's just go through some figures very quickly in the next 2-3 minutes. And let's see, why is the health economy so important? Well, health economy is important, and it's really important to measure it because it's a distinct economic sector that includes all the activity related to having healthy people and a healthy population. And this is projected into the economy and to the society, and it's measured as such. So here, I'm not going to go over this, but you can see Why? Because of its links with other sectors, because of the ecosystem, innovative ecosystem that it's giving rise, because of the better quality works, because of wealth. All of these things that we said before have been kind of schematically placed in this table. Just to give you an idea for whoever is not familiar with the health economy, according to the to our calculations at WifOR, the health economy contributed $6.3 trillion back in 2019. So that's like twice the GDP of France, and had an employment contribution, something less than 194 million people. So that's like employment of the United States of America and Canada together. And equivalently, you see the figures for Europe here in this little blue box. And in Germany, just to give you an idea, for every 8th euro that is produced, it's produced by activity that's related to the health economy. And every 6th job is again related to the health economy. These are the figures for the EU health economy. Big contributor, 9.6 GDP, 12.5 labor. And this is the global average. Okay, the numbers of the global average. Again, these are some numbers. You'll see that it also boosts export. The health economy is a big export generator, so it helps the trade balance. Okay, and here you get some comparative numbers. So you see a big span of these percentages in terms of contribution, and some conclusive remarks. So, you know, in WifOR, we work globally. So we do this in most of the countries around the world, and we are promoting this paradigm shift. And the reason we're doing it is because, you know, we are providing a common denominator for political stakeholders, the governments, with companies and associations to be communicating fact-based numbers. And again, there are certain benefits of using this methodology. We have comparability. It's a macroeconomic approach, so it's really necessary to have this dimension as well. It's evidence-based, and it gives insights that supports decision-making in economic and health policymakers. So that's why I talked about the consolidated approaches. And it's really a starting point of an objective dialogue between these partners. So health investment is the smartest investment because it pays off. That's a quote from Dr. Susanna Jakob, the WHO Regional Director of Europe. And health systems are significant contributors to sustainable and inclusive growth, helping to create benefits for the whole community, and particularly for those left behind. It reduces inequalities, and it drives inclusive growth for all society. So this comes to the end of my lecture. We have just 1 minute. I would gladly take any questions. And after that, I would please ask you, if possible, whoever wants just to open the your camera so we can take a picture, if you don't mind, whoever is left, because some people have dropped out from the discussion. So is there any question at this moment that we can go over very quickly, give a response? I hope I left you with some insights. Could I kindly ask you if you could, some of you at least open the camera so we can take a picture? Or that would be, yes, I see Mr. Anziotti, Mr. Data, thank you very much. Anyone else would like to be in the picture? Yes, Mr. Papastefano. Anyone else, or should we go ahead and shoot the picture? Oops, hold on. Thank you very, very much. Thank you for your participation. I hope I gave you some thoughts and some triggering points to kind of think further. And I will be sharing, thank you very much for the applause, and I will be sharing this recording that Ms. Karantziotti was kind enough to do. And also I will share the presentation for whoever wants to further look into the numbers or share with other people. I'm going to post this in my LinkedIn page, so please do visit it and comment if you wish. I would greatly appreciate this. And thank you very much. I wish a very, very nice weekend to all of you. And I hope that we will continue these discussions in the very near future. Thank you to all.
Thank you, Professor.
Bye-bye.
Thank you, Professor.
Bye, Professor.
Thank you.